boxing, baseball, lacrosse, skateboarding, hockey, cycling, basketball, and other high-impact or extreme sports. Explosive blasts and other combat injuries. At Amen Clinics, we see patients with head injuries from all of these causes. In particular, we have been studying the association between football and brain injuries for 3 decades. When I first started looking at SPECT scans in 1991, I saw Pop Warner and high school players between the ages of 8 and 18 with clear evidence of traumatic brain injuries. I was horrified. And then I saw college players whose brains showed even more damage. In the past decade, I've met with over 300 active and former NFL players whose scans were even worse. Yet, using the Amen Clinic's Bright Minds program described in this book, 80% of our players show improvements in blood flow, mood, memory, and sleep. At the time of this writing, more than 350,000 military veterans have sustained a TBI since the year 2000. This means the Iraq and Afghanistan wars will likely have a 70-year tail, as these veterans will have an increased risk for psychiatric issues and dementia. The impact of those TBIs will spread beyond the veterans themselves and affect their children and succeeding generations. Research shows that head injuries increase the risk of depression, anxiety and panic disorders, psychosis, PTSD, suicide, drug and alcohol abuse, ADHD, learning problems, borderline and antisocial personality disorders, dementia, aggression, homelessness, victimization, loss of or changes in sense of smell or taste. Head trauma may also increase the risk of incarceration. In the U.S., 25 to 87% of inmates say they have suffered a TBI, compared with 25 to 38% in the general population. And the latest statistics from the Bureau of Justice Statistics show that 181,500 veterans are incarcerated. In our database of tens of thousands of patients, 40% had a significant brain injury before they came to see us. When people ask me what is the single most important lesson I've learned from looking at over 170,000 brain scans, I reply, mild traumatic brain injury is a major cause of psychiatric problems, and very few people know it. I actually hate the word mild applied to traumatic brain injuries or concussions, because it implies that they didn't cause lasting damage, which is often not the case. Anyone who has played a contact sport has likely also experienced many subconcussive blows, where the brain was jostled but did not cause immediate symptoms. It is important to note that many people forget they've had a significant head injury in the past. At Amen Clinics, we routinely ask patients several times whether or not they have had a head injury. Our intake paperwork asks the question, "Have you ever had a head injury?" The historian who gathers patients' histories before they see the physician asks them again about head injuries. The computer testing we have patients complete asks a third time about head injuries. If I see no, no, no to the question of head injuries, I'll ask again. If I get a fourth no, I will then say, "Are you sure? Have you ever fallen out of a tree, fallen off a fence, or dove into a shallow pool? Did you play contact sports? Have you ever been in a car accident?" I'm constantly amazed at how many people think their head injuries were too insignificant to mention. For others, they simply do not remember the incident, as amnesia is a common occurrence in head traumas. When asked the question for the 5th time, one patient put his hand on his forehead and said, "Oh yeah, when I was 5 years old, I fell out of a 2nd-story window." Likewise, I have had other patients forget they went through windshields, fell out of moving vehicles, or were knocked unconscious when they fell off their bicycles. Concussion Rescue is written by a smart, deeply caring naturopathic physician who has worked at Amen Clinics for many years. In this book, you will find hope, help, and a specific plan to improve your brain and rescue your mind. Daniel